Counting down.
Yes.
Hi, everyone. You're watching Health Detective. Me, Nick Tofalos, the osteopath, the Health Detective. And this is Graham Atkinson. And Graham, your background is that you were a pharmacist. Is that right?
Yeah, that's correct, Nick. I'm no longer a pharmacist, but for all of my professional career working in the English NHS, I was a registered pharmacist until the end of 2023. So my membership has lapsed, but I trained and worked as a pharmacist, although mainly as a bureaucrat and as a senior manager in the upper echelons of the NHS, locally, regionally, nationally in England.
Yeah. And before we go into that in a little bit more detail, let's take you right back to the beginnings of your life.
Mm-hmm.
What did you want to be when you were growing up?
I really, really wasn't sure. I mean, my background is I was adopted very early on in my life. I was fostered at 2 weeks old and then adopted at 4 weeks old, and that
Wow.
I was essentially forcibly, well, I was forcibly removed from my mother without her knowledge. So I was separated from my birth mum at 2 weeks old.
Yeah.
We were just talking before we got started about um, sort of gifted ladies, shall we say? And
Yeah.
I believe I'm now reunited with my mum, my birth mum.
Gosh.
She tracked me down in my late 30s, but
Really?
yeah. But I consider my mum to be a white witch. She's very interesting character, very gifted, very knowledgeable about ancient health and
Yeah.
nature, really. But that would come much later in my life. So I was
Yeah.
adopted into a sort of middle class family. My adopted dad was a bank manager. My adopted mum was a physiotherapist in the NHS.
Right.
And when I finished my A levels, or nearly finished my A levels, and you're applying for university, it's like, what should I do? And I really hadn't a clue. So I was doing science, three sciences, biology, physics, chemistry A levels. So pharmacy seemed to fit.
Right.
So I applied for pharmacy, and 4 years later qualified. Got a job in Boots the Chemist high street pharmacy here in England, but went down the management route. Never really went down the clinical route. So
Okay.
I did 16 years in management in retail pharmacy, high street pharmacy. Then joined the NHS in 2002, and I quickly became a director of commissioning. So my job was to basically run and pay for and performance manage the local NHS for about a quarter of a million, third of a million people.
So
I did that.
that's managing a serious budget then.
Yeah. Oh yes. So the total budget would be somewhere in the region of £500 million a year.
Wow.
So that paid for
Extraordinary.
all the hospitals, all the doctors' surgeries, all the drugs bill, ambulances, mental health hospital, all the community services, physios, podiatrists, you name it, health visitors, the whole shebang.
So really,
Uh,
I could have done with knowing you maybe 15, 20 years ago when I started and knocked on your door and said, please can you get my osteopathic
yeah,
skills on the NHS?
yeah. Can you give me a contract, Mr.
Yeah.
Commissioner? Yeah.
Yeah. And you'd have spoken some strange language to me about all kinds of, with lots of letters and things that I wouldn't have understood.
I possibly would have done. I guess I mean, going back to sort of my beginnings, I never really felt I fitted in anywhere. I never fitted in at school. I
Mm.
never fitted in at. I went to Polytechnic. I didn't get into university, which I think was one of my saving graces.
Yeah.
I was spared university. Went to Poly, um, and but I never felt I fitted in really in the upper echelons of Boots, and certainly in the NHS. So I didn't tend to use the language, or I probably did, from an outside person's perspective. But
Yeah.
I was never really in on the inside, and I frequently had comings together with senior people because I always wanted to do the right thing. I always wanted to promote true health and
Yeah.
do things like primary prevention. I wasn't interested in doing more and more and more operations. So I would,
Mm.
I had, for about 10 years, I had the ability to walk into a chief exec of a hospital and say, look, I don't want to buy as many knee replacements or as many hip replacements, or not hips, because they're generally, well, no, hips as well. They can be elective. A lot of them are done emergency wise these days. But
Yeah.
let's say, look, most of your people who are getting knee replacements are actually overweight and they're
Yeah.
not well. So we're going to
Yeah.
spend money on getting them well and reduce their weight. So we need less operations. So
Yeah.
I'm going to buy less operations. That would set the sparks flying because that reduces hospital income, and you end up having fights with all sorts of people that you didn't know existed.
They're little empires.
Yeah, including the politicians. The MPs would come out and fight me and that sort of thing.
Wow.
But I spent many years trying to improve diabetes services and particularly respiratory services.
Yeah.
Again, just wanting to invest money upstream in primary prevention and secondary prevention so that people didn't end up cascading into hospital and needing operations and having their feet amputated because they're diabetic and losing their
Yeah.
eyesight, that sort of thing. And by and large, 20 years of effort in that field broadly failed, with one fairly significant exception. I managed in the northwest of England, the area where I live here, to introduce a community respiratory service.
Right.
And the very simple logic behind it, which was upskill the doctors and the nurses in the community, involve physiotherapists, involve other health workers, and get them trained up by the consultants in hospital that would see somebody when they had a major respiratory exacerbation, so COPD. So these would be chronic smokers, or maybe people who'd worked in the metal industry or paint, and they got lung injuries all their lives and they couldn't breathe very well. But if you looked after them well in the community, they didn't need to go to hospital.
Yeah.
So it took me 3 years to get this through, and our ambition was we wanted to greatly reduce the number of emergency admissions to hospital and also planned admissions to hospital.
Yeah.
And after 12 months of implementing this in my area, we halved the number of emergency admissions for respiratory.
Wow.
And we halved the number of planned admissions for respiratory. So it's not hard to do, Nick. I'm sure you would. Many of your listeners or your viewers
I'd run
will
with it.
understand this. Yeah.
I mean, that's extraordinary. Half. That's so. If the numbers is one thing, but when you look at that, if you've halved the number of emergencies, halved the number of planned, you actually go back right down to the people who would have had those emergencies. The massive change in people's well-being, mental health, the worry for them, for their families, this knock-on effect into the community of halving that is actually, I would say, immeasurable. It's incredibly a huge effect.
It is, and my real ambition was to tackle metabolic disease, because I don't believe type 2 diabetes is a single disease. It's just one of a myriad of symptoms that result from poor metabolic health. Yeah. And I wanted through the sort of lens of type 2 diabetes, because that's the only description that NHS recognises.
Yeah.
I wanted to do the same thing, and again, I ended up having fights with orthopedic surgeons who wanted to keep their lists of amputees full. It was like, I'm going to do less operations if you do this. Ophthalmologists who, again, said the same thing. I'm going to have less people in my clinic if you prevent type 2 diabetes, and I'm going to lose my status and my income. And the director of finance would fight me. We're going to lose our income in hospital. So it took me 20 years, and I never managed to get a type 2 reversal program implemented in the NHS, despite trying in a number of areas.
Which you'd think the whole system is crying out for.
Well, that's the ridiculous thing. If you read the government priorities for the NHS, and you read the planning documentation that comes out every year, in England, the government gives the NHS, if you like, a set of priorities. It's called a mandate. and there's an NHS plan, normally a 5, 20, or 10 or 20-year plan. And my job would be to read that in detail and then produce a local commissioning response. And so in the documents they would say we're going to reduce the number of people with diabetes, we're going to help people stay well in the community, we're going to reduce hospital care. It would say all those things.
Yeah.
So I would say, right, that's fine. I know how to do those things. So I'm going to change these contracts. I'm going to move some money around, and I'm going to employ people in the community, and I'm going to reduce the amount of beds we need in hospital. And that's the alarm bell. That's the canary in the coal mine for the NHS bureaucrats and the politicians. As soon as you say, I'm going to reduce beds in hospital, because that's the only way you can save money in hospital.
Yeah.
If you don't take the beds out, they will be filled with something else, and the money gets spent in another way. So you have to take the beds out, and you have to close wards, and you have to reduce the number of clinical staff that are employed. But that's all necessary and inevitable when you prevent things going wrong in the first place.
Yeah.
But as soon as you try and implement that, you find you're almost the lone person who actually is saying that, and everybody else will fight you.
Yeah.
So yeah, my career, my
amazing.
sort of progression came to an end several times in the NHS when my altruistic approach, if you like, wasn't liked, in certain areas.
It's actually your approach is in the words they print in their documents, but not in their actions.
Correct. Yeah.
And so it's dressed up, but the actual reality is a business model.
Yeah.
That doesn't.
A director of finance once said to me, Graham, you need to understand the NHS is a perfectly formed hierarchy and system, and its purpose is to defend itself against any change.
Yeah.
And I thought, right, okay.
just like the world as a whole, but
yes, exactly,
in a microcosm.
Yeah.
I mean, it takes me back to, so when you have specialists like an eye specialist or a heart specialist or an ankle specialist, of course, if you threaten, you weren't threatening, but if they see less people coming with that problem, obviously they're going to feel threatened. And this is one of the problems you've got. Making everyone a specialist means they're no. So as an example, just as an osteopath, I will take on anyone who walks through my door, whether they've got an eye problem, a knee problem, a back problem, or a gut problem. I am curious enough and interested enough and hopefully broad enough to be able to start looking at how we help them become healthy.
Yes.
So I'll take all that on. But an ankle surgeon who only does ankle surgery, you say, well, why don't you start helping people with their mental health? It will blow them so far away from their mindset of, but I'm an ankle surgeon. What about human beings? The people you look after, the people you manage.
Well, you're talking about holistic wellness and healthcare there, which was basically designed out of the allopathic health system. There's several stages to this, and I sort of educated myself after leaving the NHS on how it had become so bad at being a health system, because it's not a health system, it's an illness system. So there was several landmark things happened, if you like, in the Western world, because you're trained in a holistic whole person discipline, and those disciplines, like yours, were significantly curtailed in 1913 with the Flexner Report that came through in America. So I'm sure many of you listeners and viewers will have heard of the Flexner Report, but the Flexner Report was commissioned by the Rockefellers, and it was paid for by the Carnegie Foundation, and the American Medical Association essentially stopped funding almost entirely the disciplines of healthcare that weren't medicine. So that the modern doctor, go back 120 years, there were lots of medicine men, if you like, and women around the world, around the Western world, and some of them were chiropractors, some of them were herbalists, some of them were homeopaths, some of them were doctors. and the discipline of modern medicine became the predominant taught discipline in universities,
Yeah.
and it was tied into the Rockefeller, John D. Rockefeller was part of this, and he owned Standard Oil,
Yeah.
biggest oil company in the world. And one of the problems that an oil company had at that time was the sort of sludge that's in the bottom of the refinery when they've made petrol and diesel and all the rest of it. And this sludge can be used to make pharmaceutical drugs. But there wasn't a market for pharmaceutical drugs in 1913, so they created a market, and they said that the purpose of modern medicine and doctors is to diagnose diseases. So this is where diseases came from.
Yeah.
So, and you can split the word disease into dis-ease.
Yeah.
So you and I would recognize holistically that somebody isn't at ease, and we would try and put them back at ease.
Indeed.
Whereas a doctor will say, well, what disease code can I enter into my computer that describes your symptoms? And after the disease code's been entered, the label is placed on the patient's forehead and it never is removed.
Yeah.
And the treatment is drugs, pharmaceutical drugs. They're not interested in cure. They're not interested in prevention. They're interested in symptom suppression.
Yeah.
So that was 1913. You can go back 100 or so years before that, and it was actually in the Napoleonic Wars. Before the Napoleonic Wars, there weren't any hospitals. Doctors, as we know them now, were split into, there were surgeons, and there were two types of surgeons, and there was sort of holistic medicine men, if you like. I'm trying to think of the right word for them. But essentially during the Napoleonic Wars, they realised the injured soldiers weren't being returned to the battlefield quick enough. So at a time of war, in crisis, they instituted a new form of medicine, if you like, and they said, right, we're going to create hospitals for these injured soldiers. Now, previously, hospitals were infirmaries, and they were attached to churches.
Yes, indeed.
And monks and nuns used to look after unwell people in infirmaries.
Maid Marian and co.
Yeah, that was stopped, and they took that function away and created hospitals, and then they forced the surgeons and the other medicine men, the doctors, to join as a single profession. Right. And so this is where surgery ruled, because the surgeons were preeminent. They got on top of medicine, and also it started the phase of what's called reductionism. So rather than looking at holistic patient, they said, well, there's a doctor over here that specialises in heart, and there's one here that specialises in livers, and then there's one here that does limbs. And then you got subspecialisms and subspecialisms. So as you say, Nick, now we've got surgeons, orthopedic surgeons, who will only do shoulders or wrists. And in fact, I this is not a joke. I once had a long waiting list in a hospital in the northwest of England, and I said, can we get your surgeon to work weekends? We've got a lot of, I think it was shoulders. We've got a lot of shoulders on the waiting list. We need to get the waiting list down. And the answer I was told was, well, the surgeon you're asking to come in only does left shoulders, and a lot of the people on the waiting list are right shoulders, or something like that, you know.
Wow.
So that's how specialised doctors get. So when you're looking through the lens of metabolic disease, they just don't see it, because they're looking at symptoms in their little box, and they can't dial back and look at the big picture and say, well, this person's unwell, they're in dis-ease because their insulin's really high, and it has been high for 30 years because they've got a crappy diet. The sort of things that you and I would just instantly know.
Yeah. I mean,
so that's how that in a nutshell is how we came to be where we are.
That's the thread that's brought us here. Yeah.
Yeah. And it's broken. The system's broken, and I don't think it can be mended. I think it has to totally collapse and fail in order to be swept away. I think it's like all like all systems, they have their time, and I think its time is coming to an end now. And when enough patients and staff in the system realise that it's not a healthcare system, something else will come in its place. And I think you and I are some of the seed to help the new system take root, because we
Hmm.
can't change the old system. We've got to build a new system and make the old system redundant. That's
Yeah,
why we're here.
let's hope so. Um, I've got a book by a guy called Pottinger,
Yes.
from the 1920s, and in the first few paragraphs, he talks about in the future, um, the medical system will not be filled with specialists. They will be people who understand the body as a whole.
Yeah.
Far more eloquently put than that,
Mm.
but you get the meaning. And well, maybe the future he was looking at is about 150 years on. I don't know. We'll
Well,
see.
and I think it really is back to the future, Nick, because this holistic, healthcare did exist
Yeah,
prior to allopathy, and it still exists all around the world. If you go, you've got the Ayurvedic medicine in India, you've got the Chinese medicine, and if you go to South America or the Indians in Alaska, you will find a holistic medicine system. And Africa,
yeah,
you go to the tribes in Africa. This is just how human health has worked for thousands of years all around the world, apart from in the Western allopathic system,
yeah,
where it's been hijacked by corporations essentially,
yeah, yeah,
for the purpose of making money out of ill people.
yeah. Indeed, sad but true.
Mm.
And that brings us to the thread, which was one of my TikTok posts that I did
Mm.
a while ago, which was just around Christmas time last year and into this year. I needed a letter signing by the doctor, just for your fitness to practice kind of thing. You're in good health, that kind of thing. They actually told me I'd not been to the doctors for 20 years. I was like, yeah, I try and avoid you.
Mm.
And I walked into two different doctors' surgeries, chasing a doctor to sign a form, and they told me it takes 6 weeks to get this done, but I managed to pull a few strings here and there and got it done
Hmm.
in a few days. But nevertheless, walking into two doctors' practices, and there was not a single patient in either of them, and these were big practices. And the last time I had been to a doctor's surgery, it seemed there were plenty of people in the waiting rooms waiting, and your name would be called out and you'd go in. And these rooms were silent and empty like a library. So I put this out, where have all the patients gone? What's happened on
Mm.
TikTok? And people came piling in with loads of comments about, yeah, you're right. Same here, same here, same here. There were a few exceptions. There were some people piped up saying, oh, it seems fine at my GPs, but the vast majority.
Hmm.
And then that led to lots of comments like, well, the doctors are lazy, they're all doing private work, they're all they only work 2 days a week, and I thought, once upon a time, doctors, and certainly when I was a kid, you know they came round to my house when we were little. One of them would share a glass of whiskey with my dad on his
Mm.
rounds, and we knew them. They were your family doctor, and you knew them all your life. My doctor, one of them, I remember seeing him when I was probably 18 or 19, and the first time I saw him was probably when I was 3 or 4.
Mm.
He genuinely was a family doctor,
Yeah.
and held in some esteem as well. And I looked at all these comments and thought, gosh, the respect for doctors or GPs seems to have faded.
Mm.
And what has actually happened? Where are all the patients? So, what insights have you got
Mm.
into that so that I can let people know?
Yeah. So there's a lot to unpack there,
Right.
but I suppose you're absolutely right. The concept of a family doctor who knows his or her patient list, and it would typically be maybe 1,500 people per GP.
Okay.
But amongst that, you've got all age groups, and you've got the vast majority are very well. So the ones who frequent the doctor's practice, once or twice a month, or maybe every day. Some of them, unfortunately, the
Yeah.
doctor would get to know them very well. So there's this concept of what they call longitudinal care, where you see the same doctor every time,
Yeah.
and if there is a progression in a disease or symptoms, then that doctor will see it straight away. They don't need to spend 20 minutes catching up on the notes that the previous doctor wrote, or the nurse, or whatever.
Yeah.
So this change. So we're talking about the English system here, and there probably are parallels all around the world in the Western healthcare system. But in the English system, a new doctor's contract came in 2004, and that changed things dramatically in primary care, in doctor surgery. So, for one, the responsibility for providing out-of-hours care was no longer imposed on GPs. So when you and I were young, our GP, if we rang in the middle of the night, it would be our GP that had to do something.
Right.
From 2004 at 6:30 p.m. Monday to Friday, the phone switch to an out-of-hours service. So all these new out-of-hours services sprung up all around England, and a lot of them are run by doctors who are, if you like, their other job is to be a partner in an out-of-hours service. So they might do 2 days a week in their GP practice, and then they'll be a director of an out-of-hours service, and they might work Sunday afternoon or Friday night or that sort of thing.
Okay.
So that's one change. I think politically there's been a change as well. I think there is definitely an agenda, and I will call it an agenda, to reduce the standing of general practitioners in our society. So there is a deliberate government agenda. So if you don't know, in England, in the NHS, GPs, general practitioners, are running a private business. It is their own private business. They are not employed by the NHS. So it's not like a hospital doctor or your midwife who are employed NHS staff. A GP, a general practice, is a private business, the same as a dentist practice, the same as a pharmacy and an optometry. So the four high street, if you like, they're called independent practitioners, independent practices. So it's a private business. Yeah. That right was won by the GPs, by the British Medical Association in 1947 when the NHS was set up. Now, I believe, and it's pretty clear, that the government has an agenda to end that status. And what the government want to do is to very slowly, gradually move general practice into either a contracted out model. So it's, it might be Virgin Healthcare, or it might be Amazon Healthcare. Yeah. Run your GP practice. And with that comes, AI and remote telephone and video consultations, and your prescription will arrive by courier the next morning. All of that's tied together.
Yeah.
So the concept of your friendly local GP practice that you could walk into and say, "Can I see Dr. Smith that I saw yesterday?" That, from our government's perspective, is something that they want to end, because there is a phrase in the NHS. When you try to negotiate with GPs, the phrase is actually herding cats.
Yes.
And the government hates herding cats. What the government wants to do is have, the minister wants to pull a lever in Whitehall, and the whole NHS reacts exactly as
compliant group. Say, yes, sir.
Yeah. So when you've got an independent contractor status, you've got tens of thousands of GP practices all across the country. They're all running in different directions. They've all got different views and opinions. They all speak slightly different languages. Not literally. I'm just saying. The type of practice, it isn't the same all across the country.
Representing different populations and
exactly, yeah. And you've got the union. You've got the British Medical Association representing doctors, so there's a union to negotiate with, so the government has to negotiate with the union all the time. So all of this is difficult to manage if you're a Whitehall bureaucrat or a politician. So I believe, and I've over the last 20 years, I've seen a steady progress in the direction of ending the general practice independent status. So what's happening across the country is it's a bit like farms. If you want to farm beef and you've got 10 cows, it's just not worthwhile anymore. It's the same in general practice. If you're two doctors and you've got 3,000 patients and you're in the sticks in where you live, in the centre, a long way from anywhere, you're just not going to manage a viable business anymore. The economics of it don't work out.
Yeah.
So that's another part of it. The 2020 agenda and that whole debacle accelerated this.
Okay.
So what happened in March 2020 when the world went into lockdown was
Yeah.
GPs, they didn't shut. I mean, I was running a GP practice at the time. We didn't shut, but we put a significant amount of our staff working from home, and video consultations and phone consultations became the norm. And the NHS hasn't gone back to the previous situation prior to 2020. It's ended up in a new state, which is a significant number of consultations now are on the phone and increasingly so on video.
Yeah.
So the numbers of face-to-face consultations with GPs in their own practice is less now than it was 4 years ago, 5 years ago.
Okay, so
But
that was 2020 was almost like a switch being flicked.
yeah, yeah,
You
and
could do the equivalent with loads of people in my little health food shop in Garstang. A lot of elderly
mhm,
would never use contactless cards. They would use cash.
yeah,
They now all use contactless, and
yes,
literally, like overnight,
yeah,
cash almost
yeah.
disappeared.
Well, it
So carry
was
on, please.
yeah. So a lot of things happened in 2020, didn't they, Nick? But I believe the whole pandemic, and it was an invention of corporations and governments. There was no health emergency. Let me make that very clear. But it
You were
was
in it. You were in the
I,
middle of
I was
that.
in it. Yeah, I mean the reason I'm no longer a pharmacist and no longer run a GP practice is I realised. I mean, initially I was very scared. I fell for it because I'd had 20 odd years of inculcation. Inculcation is the word I've learned now. So
Okay.
indoctrination. I was trained as a senior director, basically, so when a pandemic or a national emergency hit, I'd be one of the people running the show from a bunker, that kind of thing.
Yeah.
So I had that programming in me. So when being on the receiving end of the NHS communications every day, running a GP
Yeah.
practice, I believed there was something coming to the UK, and
Mm.
I was very scared along with my staff. But 4 weeks into it, I realised we weren't in the middle of a worldwide pandemic, and I started speaking out. I started measuring everything, and I've presented all over the internet, and I've done lots of talks in the UK. I think a lot of this content's still on the internet as the red
Mm.
pill pharmacist.
Yeah.
But essentially, respiratory death rates actually reduced in 2020 in the UK
Wow.
compared to the previous year. Flu disappeared, sepsis disappeared. So basically, what was called COVID and labelled as COVID deaths were actually called something else the previous year, but they just changed the name on the coffin, if you like. And a
Yeah.
lot of that was fakery. Doctors were told to complete death certificates in a certain way without seeing the body. The whole testing was a complete sham and debacle. There's no science in the PCR tests or any of the other testing that was done. So this whole era was used to change the way general practice works, and we're now the legacy of that era is that you're less likely to see your GP face to face. You're more likely to see another clinician in primary care that isn't a doctor. So there's been a big push to employ more nurses, more
Yeah.
pharmacists,
Hmm.
more paramedics. So a lot of GP practices now employ paramedics, they employ pharmacists.
Is that because they're cheaper?
That's partially, yeah, that's partially it, I think. But without getting into the technicalities of it, the government
Yeah.
has created a new budget for new staff. So the budget to pay for GPs has been squeezed, and you'll hear GPs talking about this. The BMA are banging the drum at the minute, so they're getting about 2% inflation on their core GP contract because the growth money has been funneled into a separate fund which pays for nurses, paramedics, and other allied health care professionals. So when you contact your GP practice, you're likely to be triaged, and you'll be triaged to an appropriate clinician. And that may well be the GP, and you may well get to see the GP today if it's very, very urgent, but more likely you'll be triaged into a less urgent appointment, and you may see an advanced nurse practitioner or a pharmacist. My own wife's an advanced pharmacy practitioner. And in
Yeah.
fact, right now she's working in a GP practice doing exactly this job. She's seeing patients that probably would have seen a GP 5 years ago.
Right.
And so the whole NHS has pivoted away from GP centric, your family doctor. I mean, back when you and I were kids, Nick, that there may not even have been a nurse in the GP practice. They might have had a part-time nurse, and usually it was the wife of the GP, and they did 2 days a week.
Yeah.
Now, you'll have in a big size practice, you might have 10 GPs, and you might have 20 nurses and 15 pharmacists and 4 paramedics. And there's a new class of clinician called, well, they're not clinicians, they're healthcare workers, social prescribers. So these are people who are supposed to coach you, like well-being coaches, that kind of thing.
Okay. Yeah.
So all of that's changed, and there are less GPs now than there were 5 years ago, 10 years ago, 20 years ago. The government has had a target to recruit more GPs, but they fail repeatedly.
Do we know why they're failing? Why are we not getting people coming through?
Well, there's more and more doctors being trained in medical school, but in the last 20 years, the vast majority, the big growth area has been in hospital doctors. So
okay, right.
So the last time I checked, there was something like 10 to 15% more doctors in hospitals than, say, in 2005. They're not doing any more work, but their work is more complex, and there's more bureaucracy. And so they're all mired in red tape and forms and paper filling, that sort of thing. So they see less patients per doctor in hospital.
Gosh.
And the same is true in general practice as well, that the amount of paperwork and bureaucracy has gone up. So, a lot of doctors have what they call portfolio careers. So they might work 4 days a week, but they might only do 2.5 days of clinical time, and they do 1.5 days of management time. And they're behind the scenes, trying to run the business, trying to, it might be the out-of-hours service, or they might have a job in the local bureaucracy as a medical director. There's quite a few doctors are involved in training and training new medical students. So there's a whole variety of factors why you can walk into a GP practice today and there's nobody there. And part of that is that the appointment systems are far more efficient than they used to be. So the concept of everybody, the doors open at 8:30 and 20 people rush in and have to wait, that's all gone. And you phone up in advance, or you might complete a questionnaire on your phone. You're triaged. You're told exactly when to come, and you go at that time, and you'll be seen almost straight away because there's not much waiting around anymore. So the waiting rooms aren't as busy as they used to be, but
so that's a good thing.
That's a good thing.
That has to be a good thing, doesn't it?
It has to be a good thing. And I did check prior to coming on. I looked at the NHS England statistics for GP activity, and according to the official statistics, there are more patient contacts now than there were 2 years ago. So now there's a variety of different types of contacts in there. So I think the face-to-face GP contacts is about the same, but interestingly, in the last year, GP home visits has gone up dramatically. So home visits are for people who are unable to mobilise and get out of their house and go to the GP practice. So there are a lot of very sick, unwell people who are stuck in their own houses, more so than a year or 2 years ago. And I think it's probably the last point I'll mention is that I believe the complexity of disease or unwellness in the community is increasing. So 10, 20 years ago, you would have a diabetic and they might have high blood pressure. You've now got a patient in front of you who's got cancer, they're diabetic, they've got a mental health condition, they've got rheumatoid arthritis, and they've got you name it. They'll probably got when I first became a pharmacist, if I dispensed a prescription for somebody and there was 2, 3, 4 drugs on the prescription, that would be the norm for somebody over 65. Now it's like 15 drugs,
Yeah.
and it's for people over 45. So
Scary.
it's very scary. So
It's
there's
making
been,
people sick. It's making people ill.
it is, and this is called polypharmacy, and polypharmacy is one of the biggest drivers of death rates around the world. The study's been done in America, and I think the same's true around the world. I think 20 years ago, the number one cause of death in America, sorry, the number three cause of death was the healthcare system. So cancer and heart disease were one and two, and 20 years ago, the health system itself, so this is drugs, this is operations gone wrong, this is medical neglect, was number three. I think by 10 years ago, the healthcare system was the leading cause of death in America. And I dread to think what it is now. It's going to way exceed cancer and heart disease. So
It's
basically,
horrific.
the more doctors you have, and you can look at this in America state by state, the states that have got the most doctors per patient have the highest death rates.
Wow.
So your doctor's surgery being quiet may not be a bad thing.
Yeah, indeed. Yeah, I mean, so you obviously you had training. I mean, it's a while ago in pharmacy, but nevertheless, I always tell my patients, because the record I had was a patient with 17 drugs, and she was dying. It was horrific to watch, and actually, I was doing a home visit to her, and I remember as I was going in, her doctor was coming out, right, and he'd cycled to her. I went, I'm glad I've seen you. Could I have a word about her medication? And I'm not kidding you, right? He dashed past me, jumped on his bike, glanced behind me at me, and fled. And that was that.
Yeah.
This poor, poor, sick woman. And I tried to explain to her that 17 drugs was making her ill. And I say this to my patients now. I reckon probably put 1, 2, 3, maybe 4 drugs together, and we can try to get a head round the interactions.
You can't.
You probably can't even with that, to be honest.
No.
1 or 2 together we can. Once you put 3 in the mix, or 4,
No.
we haven't got a clue what's
No.
going on in your body, except it probably isn't very good.
Correct. Yeah. So as a pharmacist, we're trained in, and I did believe, Nick, that drugs were necessary at some point in my career.
Yeah.
And I was challenged a few years ago to come up with a list of drugs that we would, let's say we completely rebirth the healthcare around the world, and we end up with this altruistic, holistic healthcare wellness system that we created from scratch. What drugs would we take with us? And the list is very small.
Yeah.
Very, very small. Now, all drugs are tested. If they are tested, and that's another story with the latest jibby jabs and things like that, because they're not even tested.
No.
But drugs used to be tested, but they're only tested on their own. They're not tested in combination with other drugs. So when a list of side effects is on the packet or the that applies to that pharmaceutical product being taken alone on its own.
Yeah.
As soon as you mix that with another pharmaceutical product, it's
a journey
like,
into the unknown.
It's 2 times 2 is 4, and then the third one, 2 times 2 times 2 is 8. Yeah, journey into the unknown, definitely. So, I mean, you had 17. I think I've had 26.
Wow.
Patient with 26 drugs on their. And
were they upright?
Barely. I think they were a care home resident.
Poor
But
person.
So I'll say a couple of things. So prescribers, so clinicians who have prescribing rights. It used to be doctors and some nurses. It's now becoming everybody. So pharmacists. My wife qualified as a prescriber in about 2001. Now paramedics are prescribers. Podiatrists can prescribe certain things. But prescribers. And so the job of a pharmacist used to be what we call medication review and de-prescribing. De-prescribing is taking a drug off the patient, stopping it.
Yeah.
And that job is necessary because doctors and nurses basically prescribe and never take away the drug, which is why
Yeah.
your doctor ran away from you because they don't know how to stop taking something, because stop prescribing it, because they are fearful of litigation.
Yeah.
So what they do when a patient has symptoms, they follow the guidance, and the guidance says prescribe another drug. As soon as you say, well, my patient's unwell with these 17 drugs, I'm going to stop them. If
Yeah.
something goes wrong,
Yeah.
it's that doctor's neck on the line.
Yeah. Which one did you take off them? And they died the day after?
Yes,
Yeah.
exactly. Now, all GPs will tell you they'll go into a care home, residential or nursing home, and they'll do a ward round type thing, and there'll be a lady there who's at death's door, and they'll say, all right, well, let's just stop all medication, because there's no point in her having her 17 drugs now, because she's probably going to die in the next day or two. So to be kind, we'll stop feeding her these drugs. And what the doctors will tell you is quite often that patient rallies and they get
Yeah.
better.
Yeah. It's a miracle.
It's a miracle. They're no longer on the
Yeah.
cancel the undertaker. She's in the in the kitchen having a dinner.
She's having a dance on the landing.
Yeah.
Yeah.
So all doctors will tell you stories like that.
Yeah.
And it just makes sense, doesn't it? I mean, most
Of course it
drugs are
does.
excreted by the kidneys and the liver, and the load on the kidney and the liver, from 17 drugs is enormous. You take that load away, and suddenly the liver and the kidneys can clean up the body.
Yeah,
And
if
do
you
what
can
they should do.
manage the detox bit and get through the
Yeah,
potential crash of withdrawal symptoms, you may well have a better person at the end of it, a healthier person.
absolutely. So pharmacists do med reviews, and it's generally the only professional group that will review a patient holistically and say, right, well, we need to stop a lot of these drugs. Now that 10, 15, 20 years ago, that was quite easy. And one of the jobs I did when I used to work for Boots was to go into a care home and do care home med reviews. And with my limited clinical expertise at the time, I was able to recommend stopping certain drugs. Like of these 6 drugs, we don't need 2 of them, because those 2 are actually treating the side effects of the other one. Now, even a pharmacist like my wife, who's 33 years in, very, 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 very experienced pharmacist, when she's faced with a med review of 17 drugs, even she is saying, I don't think I can work out which one to take away. It's just become so complicated, and the fear of doing something wrong is
Yeah,
predominant now.
it's always
That
there. That
Yeah, so I think we're on a fast track to oblivion with this. There is no happy ending to the pharmaceutical allopathic system. The people who still worship in the church of allopathy, be they patients or clinicians, are being deceived, and some of them may never recover. And this is one of the points. I've gone through a lot of grief in the last 3 or 4 years, because I was trying to wake people up to what was going on. And I've realized that a lot of people don't want to be woken up.
no.
Even if you tell them and give them the evidence, they want to keep going to the doctor. And I mean, this was true with my own adopted mum and my mum-in-law, who both lived here with me, and I was their primary carer for a couple of years. They both died from allopathy in the last 15 months. And I watched it happen very slowly, very painfully. And there are plenty of people around who still believe in the white coat and the NHS badge and the pharmacy, unfortunately. And they cannot be persuaded by people like me, because I'm a crank,
Yes.
and I don't speak the mainstream, and so I can't be trusted. But
yeah, indeed. It's a powerful hypnosis.
it is, yeah.
Graham, we could talk and talk, because I've just talked about doctors' waiting rooms, and that's taken us into a whole host of interesting areas. Yeah. And we've still got to talk to you, and we're not going to do it now, but I'm sure you've got lots of things to do. You being a carnivore, and and excuse me, and the fact that you've kind of gone on a journey yourself that has taken you completely in a 180-degree turn in your life, and none of it done for any kind of reward, particularly.
No, far from it. Yeah.
aside from perhaps for your soul,
Mm.
which is a most important thing to look after.
Yeah.
We're going to stop recording. I'm going to stop it now, Graham. So I'll say thank you, and then we'll have a little chat. But
Well, thank you, Nick. It's been a great
yeah,
chat.
much appreciated, and loads of insights there, which I will put out for my audience to enjoy. Thank you.
Mm.